So Haley came to us when she was 12 months old. She basically presented with a mass in her left thigh, and this mass on biopsy came back as rhabdomyosarcoma, which is a cancer of muscle cells. So this is a very, I mean, children's cancer is rare in first place, and this type of cancer is even rarer. It's about like maybe 3% of all childhood cancers is rhabdomyosarcoma. And Haley's case is unusual because, I mean, it's even rarer because she's so young. She's less than a year. She was diagnosed around her birthday. So she had just turned a year. And the specific type of cancer she has is something called alveolar rhabdomyosarcoma, which is the higher risk type of cancer within rhabdomyosarcoma itself. So the treatment involves surgery to take out the cancer, a lot of chemotherapy, and she'll also need radiation therapy. So it basically has everything in it. So she's started treatment here with us. She's basically in week 4. This is the 4th week of treatment with chemotherapy. And after getting a couple weeks of chemo, we are hoping that the surgeons will be able to go in and take out the rest of the tumor. They had operated on her at diagnosis, but they were not able to take out the whole tumor because it was very close to one of her nerves. So they could only partially resect it. So we are hoping the chemotherapy will shrink it enough so that they can get a good hand on it and take out all the tumor. And then whatever residual tumor is there, she will have to undergo radiation. And the plan is to get her radiated in Atlanta with proton beam radiation. So we have this is a smaller pediatric oncology program, but we do have pediatric oncology physicians and nurses who are trained to give chemotherapy to young kids. We have some social worker resources and child life. Child life plays a very big role in our clinic because these little kids, when they come into the clinic, get access, they have like these ports, they have to get a needle into the port. So the child life helps a lot in dealing with it. Then they also help with the family, understanding the procedures and stuff. And then we have community resources. Jay's Hope is a big voluntary organization. They build like a team support, family support. So we can care, and we have like some subspecialists who can always chip in if we need them. The surgeons have been great in treating Haley. They resected part of the cancer and further treatment. We do have radiation here, but being so little, I want her to get proton beam radiation, which is only available in Atlanta. And Atlanta is so close, so we always have support from the oncologists and experts there.